Hi Brandon, my name is Chrissy and I'm going to be the nurse practitioner taking care of you today. I'm going to do an abdominal assessment on you if that's okay.
Sure.
Great. So first I'm just going to inspect the abdomen, looking for evenness and looking at color, making sure there's no cyanosis, bruising, redness, or any lesions or scars, which I don't see any. Can you take a big deep breath and hold it for me? Good. The abdomen is still flat, contour is equal, and I'm not seeing any abnormalities or nodules or masses. So I'm going to have you lie down for me. And with the patient lying down, I'm just going to inspect for any peristalsis that's visible or aortic pulsations, which I can see a very light aortic pulsation right in the midline, which with his thin body, that's normal. So now I'm going to auscultate the bowel sounds. You always auscultate before palpation when you're doing the abdomen, and I should hear 5 to 35 bowel sounds per minute. I'm going to listen in each quadrant. Good, normal active bowel sounds. Next I'm going to auscultate over the liver for bruit, which I don't hear any, and also I'm going to listen over the spleen. Then I'll listen over the renal arteries. The iliac arteries. And then finally the femoral arteries. And I don't hear bruit in any of those. Next, I will percuss the abdominal quadrants. In all 4 quadrants, the sound should be tympani, which it is. Now I'm going to percuss over the liver, and we will percuss for size by percussing for the lower border by percussing up until I hear a change from tympani to dullness, and then we'll percuss down the chest until we hear a difference from resonance to dullness. That space should be about 6 to 12 centimeters, which it is. And then I'm going to assess the descent of the liver. So take a big deep breath in and hold it for me. And I'll percuss up from the lower border again. Good. And you can breathe. The liver should descend about 2 to 3 centimeters. Next, I will percuss the spleen posterior to the mid-axillary line. And I should hear dullness from the 6th to 9th rib, which I do. And then finally, I'll percuss for a gastric air bubble over the epigastric area. This should percuss at a slightly lower pitched tympani than the rest of the abdomen. Finally, I'm going to have you sit up. And I'm going to percuss the kidneys for tenderness. And I'm just going to put my palm on the patient's kidney and hit it with my fist. Then there's no tenderness.
Nope.
Great. And no guarding or resistance. So I'm going to have you lay back down. Oops, sorry. So now we're going to move on to palpation. So first I'm going to lightly palpate the abdomen, looking for resistance, guarding, or any tenderness. No tender?
No.
Okay. Then I'm going to palpate a little bit more deeply, still looking for that resistance and guarding and tenderness, but also looking for any masses or abnormalities. Okay. Not feeling anything. Then I will palpate the umbilical area and the umbilical ring, which I do not feel any abnormalities. It's round and regular, which is exactly what we're looking for. Then I'm going to palpate for the liver. So take a big breath in for me. The liver is just barely palpable, which can be normal. Okay, you can breathe. Then I'm going to palpate for the gallbladder underneath the liver, below the lower margin of the liver. And I cannot feel anything which is normal. Feeling the gallbladder would be abnormal. And then I'm going to palpate for the spleen which I'm also not palpating, which is normal. We wouldn't want to feel the spleen. That would be abnormal. Then I will palpate for the kidneys, using one hand on the flank and then one hand on top. I'm not able to palpate the kidneys, mainly due to musculature of the patient, which is normal. Sometimes the right kidney is a little more palpable than the left kidney, but in his case I can't palpate either. So finally I will palpate for the aorta, which should be just slightly left of midline. I can palpate it just barely. And then finally palpating the bladder. It may be palpable, maybe not, depending on how full the bladder is. So we just feel if the bladder is full of urine, it should feel like a smooth, round mass, which I'm not palpating anything. I think the patient needs restroom for exam. So you can sit back up. We're all finished. Watch the line. Thank you for letting me do an assessment on you today.
Thank you.